Hello everyone, I am Dr. Chaithra SK, Consultant Fertility Specialist at Ovum Hospitals, Bangalore. So today I'll be talking about top 10 fertility myths. So there is a lot of misconception when it comes to infertility, its treatment options, especially with respect to IVF and embryo transfers in the minds of common man. So I am here to bust all these infertility or IVF related myths today. Coming to the top 1 fertility myth, that is only women are affected with infertility. So it's important to understand here is that women contribute to about 1/3 of the cases of infertility. The rest 1/3 is contributed by men, and about 1/3 of the cases are because of a combination of factors related to both men and women. Hence, it can be taken into account that men contribute to about 50% of infertility cases. It is for this reason we emphasize that the couple should meet together to get all the infertility factors evaluated so that treatment can be started. The second most common myth is that IVF is the only treatment offered, especially in IVF centers. So when a couple walks into an IVF center, a careful evaluation of their infertility factors will be done, and there are many other treatment modalities like correction of hormonal disorders, ovulation induction, IUI treatment, fertility enhancing hysterolaparoscopic surgeries which can be offered. There is only a very selective group of people who will actually require direct IVF treatment. Hence, it should be removed from the mind that IVF centers only offer IVF as the mode of fertility treatment. Coming to the third most common myth, that is administration of hormonal injections can lead to cancers in future. It's been almost 40 years since IVF treatment has started, and these hormonal medications are nothing but a mimicking of the hormones which are generated in the female's body. Administration of these hormones, even for a repeated IVF cycles, are not proven to have an increased risk of breast cancer or ovarian cancer. Hence, this should be eliminated from a woman's mind that administration of hormones can actually cause cancer in future. Coming to the fourth common myth, that IVF is a painful procedure. So we do understand that IVF requires repeated administration of injections, be it subcutaneously or intramuscularly. Other than the prick part of the injections, the IVF treatment is not painful. The egg retrieval procedure, which is done as a part of IVF treatment, is generally done under intravenous sedation so that the patient does not feel any pain. Coming to the fifth most common fertility related myth is that absolute bed rest is required, especially after embryo transfer or IUI treatment. So this is again a myth that the embryo can actually fall off from the woman's body post transfer. So it should be understood that the embryos won't fall off like that, and requirement of absolute bed rest is again a myth, that the patient can actually carry out all her routine activities as usual post an IUI treatment or an embryo transfer. In fact, we discourage this kind of absolute bed rest because that can actually affect their circulation and in fact lead to complications such as deep vein thrombosis, which can be life-threatening in fact. The sixth commonest myth is that IVF is not a natural process. It should be understood that although the eggs are retrieved outside of a woman's body and is fertilized in the artificial culture condition in the IVF lab, the embryos will be growing in the IVF lab for about 3 to 5 days. Although the culture is done in artificial culture conditions, the process of fertilization and further division and growth of the embryos is completely natural. The cleavage or the growth which should have otherwise happened in a fallopian tube will be done in a laboratory culture conditions. Once the embryos are transferred inside the woman's womb, the further implantation and growth of the baby is a natural thing, and that cannot be altered with any of the medications. So other than the fertilization and 3 days growth in an artificial culture conditions, the whole of rest of the IVF process is natural. The seventh common myth is that the babies born through an IVF treatment are often abnormal and have developmental delays or abnormality in their milestones. It's been almost more than 40 years since the IVF has been done worldwide, and there are millions of babies who are born through IVF treatment. It has been proved by long-term studies that IVF or ICSI per se does not increase the chances of abnormal babies, and hence this has to be removed from the mind that IVF can lead to abnormal babies. The eighth commonest myth is that IVF always leads to multiple pregnancies. It should be understood that the multi-order pregnancies, be it twins or triplets, are directly related to the number of embryos which are transferred inside the woman's womb. If you opt for a single embryo transfer, then the chances of having singleton pregnancy is only there, and hence you can decrease the twins and triplet rates. It is the number of embryos you opt for during the embryo transfer which decides whether you will end up having a singleton, twins or triplet pregnancy. The ninth commonest myth is that IVF may lead to increased probability of miscarriages. We should understand that the probability of miscarriage in a natural process is about 10 to 15%, and the same is true for IVF pregnancies as well. It apparently looks like there is an increased chance of miscarriages among women who have conceived through IVF. This is because IVF is generally done for women who are of advanced maternal and advanced paternal age, which itself is a risk factor for miscarriage. The per se IVF or ICSI treatment does not increase your probability of miscarrying. The 10th misconception is that IVF can be done at any age and it's always successful. It should be understood that the government has laid down some guidelines according to which women can undergo IVF between the age of 21 to 50 and men between the age of 21 to 55, and hence we can offer IVF treatment only during this age group. And age is one of the biggest determinant of IVF success rates, and hence younger the age group of the couple, the higher is the success rates. Hence it's always best to undergo IVF treatment at a younger age. And the success rates of IVF depends upon a lot more factors other than age, the duration of infertility, the cause of infertility, the gamete quality, the lab culture conditions and associated comorbidities. So don't be under the assumption that IVF is always 100% successful. The normal success rates of IVF is about 60 to 65%, and the live birth rate or a take-home baby rate is about 40 to 45%, which again is dependent on many variables. Hence, speak to your fertility expert, understand your probable causes of infertility and how it can be overcome, and how to maximize your success rates in an IVF treatment.